Hi, I'm Mary Jane Minkin, and I'm an obstetrician gynecologist, and we're here today to talk about menopause. Menopause is basically defined as the cessation of ovarian function, and this is a normal phenomenon that happens to all women, hoping we live long enough to go through this time frame. Although the average age of menopause in this country is 51.4 years, the range of normal is really quite wide, and indeed there are women who go through menopause as early as age 35 or as late as age 60, so there's a wide range of normal. What happens to women is basically, for a woman who has a uterus in place, is that we stop having periods. And indeed, the definition of menopause in that setting is 1 year without a period. Now, the time frame leading up to that final year without a period, we refer to as the perimenopause. And during that time frame, women will often experience some erratic periods, although there are occasionally women who will have quite regular periods and boom, stop having a period and they won't have one for a year. But that's the unusual presentation. And during that time of erratic periods, or even women can experience symptoms before the periods get a little wacky, are a whole host of symptoms, signs and symptoms that can occur to women, which can be bothersome in some degree to some women. And we're going to be talking about that a lot today, to talk about the signs and symptoms women may experience, and if they are proving bothersome to people, how to deal with them and make things more comfortable. So that's what we're going to be talking about. And indeed, the old concept of menopause was that you went to bed one night premenopausal and woke up the next day postmenopausal. Well, that doesn't really happen, and we're going to be talking about a lot what happens during that time frame, and again, how we can make it better. Let's talk about some of the signs and symptoms that can occur in the perimenopausal transition and can occur to menopausal women. One of the first things that I'd like to talk about are some of the bleeding changes. What the bleeding changes are classically related to is a decline in ovarian function. As we get older, we know that our ovaries work less well, and indeed many women are familiar with the idea that fertility declines as we get older, that classically women in our late 30s, early 40s, many women experience problems getting pregnant, and that is indeed due to the fact that we're not ovulating as well. When we ovulate, when we make a good egg to get pregnant with, we are also making a lot of progesterone in the ovary. Now, progesterone helps maintain a pregnancy, which is why a lower level will keep you from getting pregnant, but the other problem that women experience when progesterone levels go down is they can develop some erratic bleeding. And indeed, the easiest way, I think, to think of progesterone is to think of it as the policeman of the lining of the uterus. As we go through this transition, we're still making estrogen. Our estrogen production by the ovaries may be a bit erratic, and estrogen builds up a lining of the uterus. But it's progesterone that polices the lining of the uterus and controls the menstrual cycle. And when we're making less progesterone, we can get some wacky periods. And what we often see are women with periods closer together, women with periods farther apart. 1 month they'll have a far apart cycle, or 2 months apart, and then the next time they'll have a period in 2 weeks. And this is a very classic pattern. Until you go that full year without a period, these kind of crazy periods can occur, and they're not at all weird, or they're not at all unusual. Very, very common phenomenon. However, once you go that year without a period, most likely you're done with this process of the bleeding, and any bleeding after that point you should report to your healthcare provider to have it investigated. Now, besides the bleeding issues, women going through the perimenopausal transition can experience a lot of other symptoms. What kind of symptoms? Well, there are certainly symptoms which we know are associated with changes in estrogen, although we may not know the exact mechanism of how they're associated, because the classic symptoms that's described is a hot flash, or when hot flashes occur at night, people often refer to them as night sweats. And night sweats can be very, very variable. 20% of women get none. They get no hot flashes. And they're very, very lucky. And we don't even know exactly why they don't experience them. 20% of women will get very severe hot flashes, which can truly be incapacitating. The women will break into a sweat. They'll have to stop dead in their tracks, stop what they're doing to deal with the hot flash and the sweating. And indeed, these sweats can go on for a few seconds. They can go on for a few minutes. Some folks tell me they go on for hours at a time, but that would be unusual to have one particular hot flash lasting for that long a time frame. And again, we don't know the exact mechanism of why this is going on. This is a problem to define. The good news about hot flashes, and I'm going to tell you some good news, is the fact that they do tend to get better over the course of time. Unfortunately, for about 10% of women, they will persist for 10 years or more. And that can be quite a problem for them. But the good news is for most women, the hot flashes do get better over the course of time. Now, the other problem that we know that's sort of a direct phenomenon with estrogen is the development of vaginal dryness. Vaginal dryness is a very, very common problem. It can lead to discomfort with intercourse. It can also be related to bladder issues. Sometimes women get infections in their bladder, or they get incontinence, leakage of urine, which is related to the vaginal problems. And indeed, some people refer to the genitourinary syndrome of menopause, with lumping the bladder issues and the vaginal issues together. Now, the bad news on that is that unfortunately does tend to get worse over the course of time. So early in menopause, women may not experience any vaginal dryness, and then 2, 3, 4 years later, they may say, oh my goodness, I'm developing this dryness problem, as their hot flashes are getting better. Now, so those are problems that are classically related to the estrogen situation. Now, there are a whole host of other symptoms that women oftentimes will experience at this point. Many folks think they are related to the changes in estrogen levels and perimenopausal symptoms. One of the other problems, though, in defining these problems is to say, what's the cause? Is it possibly, as we go through menopause, we're getting older? And are some of these other changes that women notice possibly more related to aging process, possibly related to the stressors that many women are experiencing at this time of life? I mean, think of your classic woman in her mid to late 40s, early 50s, whole host of issues going on in her life, which may be influencing the way she's feeling, which may not be directly related to estrogen changes. Some of these symptoms that women describe are issues with mood, that the women describe that they're just irritable, things like that. Cognitive problems can occur as far as memory. And of course, one of the other things that is probably more directly related to the lack of estrogen are sleep issues. And the reason I'm mentioning sleep with that, although it's more classically described as a estrogen change issue, is that lack of sleep can have profound effects. And of course, if a woman's not sleeping well, that she's going to not feel chipper, her brain isn't going to work so well, she may have problems remembering things. So I think these are all tied up, that women oftentimes will have sleep issues and also have the cognitive and mood issues along with that. Classic sleep disturbance that women will describe in the perimenopausal and menopausal time frame is that they're exhausted. At 9 o'clock, 10 o'clock at night, they pass out, they go to bed. But classically, these women will then wake up at midnight, 1, 2, 3 in the morning. Sometimes they wake up with a hot flash. Sometimes they just spontaneously wake up, and then they're awake. And they'll stay awake for an hour or two. They'll be up, they'll be pacing, they'll be reading. Finally, a couple hours later, they'll be able to go back to bed. But then they'll have to get up with the alarm clock at 6 o'clock in the morning. And that's why they're tired come 9 o'clock the next day. They're exhausted. And indeed, you can well imagine how this would impact on mood and cognitive issues. Now, there are other changes that women can experience at this time frame as well. And indeed, many women describe a decrease in libido, which is classically described. Of course, one of the problems to try to figure out is this decline in libido related to the vaginal dryness? And indeed, one of the things that we're going to be talking about is how to fix the vaginal dryness to make sex more comfortable and then have women hopefully secondarily be more interested in being sexually active. But there can be a separate issue with loss of libido unrelated to the discomfort. Another symptom that women will classically describe at this time frame is weight gain, which is very distressing to folks. Now, the one thing I want to say is I'm not getting you off the hook if you gain 50 pounds. That's highly unlikely to be related to menopause. But indeed, a 5 to 8 pound perimenopausal weight gain is not an uncommon phenomenon. Probably relationship to slower basal metabolic rates going on, but indeed certainly can be experienced. Another symptom that's very common that women experience is a sense of achiness. Now, women, and we're going to talk about this in a few minutes, is the issue with we often will lose bone, or we regularly lose bone as a phenomenon of less estrogen. But this achiness that women describe is really unrelated to osteoporotic changes or osteopenia changes. It's sort of an achiness that women describe, and certain women will have more of a problem with that than others. And this oftentimes is related to perimenopause. Of course, as we get older, we can develop arthritic symptoms more commonly too. So one of the tasks in finding yourself a good healthcare provider to get you through this transition time frame is to have somebody to listen to these symptoms and help you try to figure out what's causing them to make you better. We've been talking about many of the things that can happen to women in the perimenopausal transition and in menopause, and some of them sound pretty awful. The good news is there are a lot of things that we can help women with to get through this perimenopausal transition and menopause and feel much better with the symptoms. So let's start talking about things like hot flashes, night sweats, sleep issues. One of the best things that we can do is just use the environment to our advantage and to keep the environment outside as cool as we can. What that translates to for nighttime is to try to keep your bedroom as cool as you can. And indeed, if you have a partner who's not really happy with that, make sure that the partner has an electric blanket that he or she can keep up to a higher temperature, but that indeed you can keep the room nice and cool. Indeed, if you do wake up with sweating and really, soaking through your nightgown, it's a good idea to keep a change of night clothes next to your bed so that you can just get up, take off your sweaty clothes, get something nice and dry and comfortable, and get back to sleep as promptly as you can to try to minimally disrupt your sleep. During the day, keeping your environment comfortable translates into keeping layered clothing on. And what do I mean by that? Well, rather than just wearing a bulky sweater around to keep you warm, if you're menopausal, perimenopausal, you might be getting some sweating and some hot flashes, so it's good to have a shell on underneath that so you can take your heavy-duty sweater off and have a nice, comfortable shell on underneath, and then when you get cold, you can put your heavier layer back on. And that's something that many women find very helpful. There are also certain triggers that women will recognize that really get their hot flashes going. What kind of triggers do they find? They find things like spicy food, or a glass of red wine, a cup of hot coffee, or caffeinated beverages in general, all of which can trigger hot flashes. So again, try to avoid the known triggers, or if you say, I really want to have that glass of red wine, just be prepared for the hot flashes and know they're going to be coming, and will be self-limited. So those are some very simple things to do. Along a grander scale, but really very helpful for your health as well, is that there are certain lifestyle issues which are known to make hot flashes worse. For example, we do know that smokers go through menopause earlier, and when they do go through menopause, have more of a problem with hot flashes. So if you can possibly limit your cigarettes or stop smoking altogether, that's fabulous. You'll do a lot of great stuff for your health, and you'll also limit your hot flashes. So that's something that's really terrific to do if you can. Another lifestyle issue is actually trying to maintain as ideal a body weight as you can. Indeed, it is well recognized that women who are heavy suffer from hot flashes more than women who are closer to their ideal body weight. What we actually think is going on is that these women generate the hot flash centrally, and then they have sort of an extra level of insulation keeping that heat inside, which can make them more uncomfortable. So if you can lose some weight, if you are indeed overweight, you'll probably get improvement in your hot flashes. Now, the bad news is that indeed the exercise may produce some sweating, and I'm not going to say that the exercise is going to make your hot flashes go away, but the end justifies the means, and indeed the weight loss will really help your hot flashes a lot. So those are some good things for your health and for your hot flashes. So those are some very simple things that can be done. Now, there are some remedies that you can start trying on your own at home before even consulting with a healthcare provider, before medications and things like that, if you're uncomfortable. One of the oldest remedies that's been talked about and known is the addition of soy to the diet. And why does soy work? Soy basically contains some weak plant estrogens known as isoflavones, and that they may indeed help with hot flashes. It's indeed felt that that's perhaps why women of Asian descent, because they do tend to eat a higher soy diet, may have less of a problem with hot flashes than women, Caucasian women. This is certainly something that's been hypothesized. So the addition of soy may be helpful. Now, there is a slight bit of controversy, particularly in soy in women who are breast cancer survivors, because the question is, does this weak plant estrogen have any effect on the breast cancer situation? Most folks think not, but I would recommend that if you are a breast cancer survivor, you do check in with your healthcare provider, your oncologist, to check his or her recommendations and about the use of soy for relief of your hot flashes. So that's something that can be done. Now, again, we tend to encourage people to get in whole soy foods as opposed to taking in soy extracts. But again, women who don't really like soy or can't get in soy certainly can try a soy extract to see if it helps. And there is some data to support that. Now, the other non-medical formulation which has been shown to be helpful for women with hot flashes is indeed black cohosh. And black cohosh is a plant, actually it's a Native American plant in the U.S., which can be processed. And indeed, it is felt that the black cohosh extract may be helpful for hot flashes. There are certainly some data to support that. One of the problems that we have in this country with herbal products is standardization and inspection of different products. So you just have to be a little wary of the product that you're taking in. One product that my patients seem to have had good luck with is the German product Remifemin, where the extraction process is standardized and you know exactly what you're getting. And that certainly has been shown to be helpful for hot flashes for women. Once you get away from soy and cohosh, there's really very limited data on herbal products for hot flashes. So again, if the patient comes to me and says, you know, I'm really finding this evening primrose oil to be fabulous for my hot flashes, certainly I don't have data to push her to say, well, that's really got a lot of data behind it and you should stick with that. But on the other hand, if she's getting good results with it and she's feeling well with it, I'll say, fine, keep going with it if it's something safe like evening primrose oil or something like that. Well, one thing that has been looked at in the past is vitamin E. There's really not a lot of scientific data to support its use for hot flashes. And the one thing you don't want to do is take too much vitamin E. That's not a good idea. But if you find a couple hundred units a day helpful, talk to your healthcare provider, but it's probably reasonable for you to continue with that. But once you get away from those, there's not a lot of data on other products. So let's say you are experiencing persistence of hot flashes despite doing all these things. What we're going to talk about next are some medical interventions which might be very, very helpful for you to try.